Hi, everybody. It's Angela Lovezarenka from Lactation Education Resources. Thank y'all so much for joining us today. We are so honored to have Nikki Hunter Greenaway and Nikisha Killings, also known as Nikki and Nikki, here with us today to give us some updates on COVID-19, specifically around the IBLCE requirements to becoming an IBCLC. So I will turn it over to Nikki and Nikisha. If anyone has any comments or questions, please do type them into the chat. I'll be monitoring the chat and I will pass along those questions as soon as we can. So thank you for joining us, Nikki and Nikki. Take it away.
Hello.
Hello.
So happy to be here again.
Hey,
Gosh,
everyone.
is this number 7, number 8? We've been here. We've been rocking with y'all for a couple of months
A
now.
minute. A minute.
All
Thank
right.
y'all so
So,
much.
yes, yes, yes. We are so grateful for everyone who continues to show up and share and spread the word to others to join us here today. This is a very special day because one of us is celebrating a birthday, and it's not me.
Oh my gosh. Seriously?
Yes, of course. So
Jeez.
happy birthday to Nikki Hunter Greenaway, who will introduce herself and tell you all about how amazing she is. But I have to just say she is a fantastic partner, a brilliant clinician, just a great friend, and just, someone who really raises the bar and keeps it really high in terms of productivity and creativity and just continuing to put her families first and take care of her community. She is someone who it is a privilege to know and work with. So happy birthday to Nikki.
Thank you. Thank
You're
you. I
welcome.
appreciate that. Friend, sister.
And you're getting a lot of
What
happy
is
birthdays
that?
in the chat as well. So lots of people saying happy birthdays. You're
Guys.
getting all kinds of love.
She deserves
Thanks,
it.
guys. I appreciate it. I
All right,
appreciate
all right.
it.
Okay, I'll give you a second. She does not like the spotlight. All right, so
Whew,
back to
okay.
our normally scheduled program here. All right, I'm Nikisha Killings, half of Nikki and Nikki Lactation Career Consultants, Director of Equity Inclusion with Lactation Education Resources, and uh, day job is lactation consultant, private practice in South LA for a little bit longer. And then now, Nikki Hunter Greenway, birthday girl, tell us about yourself.
Okay. Hey everyone. I'm Nikki Hunter Greenaway, better known as Nurse Nikki. I am a family nurse practitioner. I am an IBCLC. I'm a mother of three, one of which the child is standing right in front of me making faces. And I am a wife to one. I have a private practice here in New Orleans where I do prenatal, postpartum, and lactation care in the home. I do home visits. I primarily work with underserved, homeless, and organizations. I partner with organizations that provide services to the underserved or marginalized communities. I'm really excited. I'm the other half of Nikki and Nikki. This has been a journey for us. We started this a couple of years ago. Some of you may not know that Nikki and Nikki has been around for a couple of years. And we've been slowly and steadily getting information, and we truly enjoy this part about our jobs and getting information to y'all. And we know today is a hot topic, and we like to say that we've done quite a bit of research
Yeah.
in preparation for this. So we have all the news you can use that is new for today that may change tomorrow. You heard me?
Yeah. Yeah.
All
Yeah.
right.
So that's it. We're here to talk about whether or not COVID-19 is a detour on the road to
Right.
IBCLC, and we will address that. First, we have to check in. In LA, it's not business as usual, but certainly as you drive around, we go out for necessities. There's a lot of cars on the road. There's a lot of people patronizing businesses that are slowly reopening, and life is getting back to usual. I would say, no, new normal. I would say that probably about half the people I see are wearing masks, and that's that's not as effective as mask wearing should be, but we do have I think quite a bit of buy-in from the community in general about the importance of wearing masks. So even though I'm seeing a lot more people out, they are at least about half to 75% of them are wearing masks to slow the spread. But our numbers continue to increase, but at a slower rate. I don't think California is quite ready to say that we have flattened the curve, but we are slowing down the new number of new cases and number of deaths. So that is good news. Good news for now.
Yeah. California is making strides and showing everybody that we are clearly not a part of the United States. 3 more months. What is that?
Yeah, we're gonna be
But
home.
y'all
We're gonna be
go and
home
set
till the
the
fall.
standard.
That's it. Yeah.
Set the standard. We did not do that in New Orleans, even though California and Louisiana are like this as far as the cases. Even though Louisiana, I think we may have had more cases.
Yeah.
At least in New Orleans per capita. And we are scheduled to do phase 1 on Friday, which most people have already get like to phase 3. So mentally in their heads, we're trying to figure out school. They're actually talking about the safest thing to do is to, do online for all year, next school year, and go back to school in 21, which hurts my entire soul. Folks are starting to do home visits again. I actually started home visits last week. It was scary. It was a little scary. I went to the shelter. No one had masks on, except me. And that was startling. Like, I just expected more just because it is an open shelter and people are coming and going all the time, but no one had on masks. So that is my reality here, knowing that I'm probably going to be the person to protect others by wearing my mask, whether they, wear one or not. So that's kind of where we are. That's kind of where we are here in New Orleans.
Yeah.
But we want to hear about where you are, and so tell us in the chat where you are and how, because this is the week, where, or in the past couple of weeks, how is your space changing? How has the order affected y'all? If you even have one, like in Fargo, they didn't really have that. But then, like, if you're in New York or somewhere, we had Sister Annie in New York. It's pretty bad there. So we want to know how this is affecting you.
How's it affecting your practice as well? What does it look like to be supporting families right now, wherever you are in the world and however it looks in your area? We'd love to hear more about, how you're experiencing this, because we're not alone. We're all in this journey together.
Right.
Yeah.
We're all in this together.
So the folks who have tuned in, Nikki, often, or primarily, I think, are interested in trying to attain IBCLC one day, and they're trying to figure out what is happening, what is new, what now? Can I still test this here? What's happening?
Right.
So we'll break it down as best we can. Okay. So first things first, the credential is still there. Like, it hasn't gone. They're still gonna get people. People are gonna be IBCLCs, but we have a disclaimer, and this is it. It's the same disclaimer we said when we started talking about COVID. This is gonna change. Like, the updates that we have are from May 9th. This is what they've recently posted. This is gonna. It's a fluid situation, just like everything in life right now is very fluid. Nothing is definitive. That being said, please constantly check their website for updates. A bit about their website. Okay. Yeah.
They did not get rid of the other updates that they had. They just been adding to the list. Go to the top to that update, and that is the most recent update, because that can be confusing for some folks. If you're on a cell phone or things like that, you're like, oh, update. No. Go all the way to the top, to the most recent update, and then that's where you need to get your information from. Check your emails constantly, things like that. So
that's what I would
know
say
that they are updating it.
Yeah, my experience has been that they email the latest and greatest, and then some days later update their website. So keep an eye on your inbox and read every
Yes.
email from IBCLC
Right.
thoroughly, word for word.
Right.
Yeah.
And making sure it's not going to spam or,
Yeah.
places like that. Update, update all of that situation so it goes to, and go to an email address that you don't have a lot of other stuff come in, because a lot of people are sending stuff right now. That's the way our Zoom meetings are coming, our GoToWebinar confirmations, like all that stuff. I've gotten way more email during the stay-at-home stuff than I've
Yeah.
ever gotten. So you may even want to create another email and update your information and have it just go to there. Your
That's a good
important stuff,
idea.
to make sure you have it all in order. So that's key. Another thing, email that you should be looking out for on April the 29th, they have not set a date, a rescheduled date for your exam. For the April 2020 folks that missed their exam, they have not set a new date yet. For that March, April, for our international folks that were taking it the last bit of March, and then the U.S. folks that take it April, they have not set that date yet. Okay, so but they also say you don't need to reapply either if you've already registered for that exam and when they do the reschedule. But they said, the best thing for you to do, check your email. Another reason
There it
why
is.
you should update your email stuff, because they will send you all of that information.
That's it. Got to be on top of those emails for sure. And if you're in tune, if you're
Right.
following some of the larger lactation supporter professional groups on social media, those guys are trying their best to keep you informed as well. So just stay. I know it may be helpful to unplug a bit right now for self-care, but check in every now and then so that you're aware of what is happening, because things are changing really fast. Yeah.
Right. Have
But
your
good to
days of the
know.
week and say, I'm going to check Tuesday, Thursday. There you go. At the beginning of the week, towards the end of the week, and then wrap it up. Like, don't get yourself bogged down in the emails.
Yeah.
A lot of you got the updated interim guidance, but I know that there is some confusion about what's going on. I do want to stress that and I'll just go ahead and read it for you. It's important to note that this document does not substantially change IBCLC's existing clinical practice eligibility requirements with respect to pathway 1, 2, and 3, but simply provides information on how IBCLC's pathway 1, 2, and 3 can be done by leveraging technology. So those requirements that you have, those haven't gone away. All right? Those haven't gone away. Your 1,000 hours, your pathway 2 hours, your pathway 3 hours, those haven't gone away. They're just telling you how you can leverage technology to do it.
Yeah.
Okay, so a lot of people were confused about, I'm still doing this. No, they're just telling you can use the phone. That's all they're doing.
Which is helpful now, right? Because we can't see people in person, or many of us have chosen not to. So they're helping us to continue to be able to meet those requirements, which is fantastic. Real quick, Angela says someone in Orlando has a thought for us. I want to make sure we grab it in case it's on this point.
It is. So to your first point of, you asking how people are doing. So give me just a moment. I'm going to unmute Tamiqua. Let me just one sec. Find her. She is in, do you know Tamiqua?
Student?
She's in Orlando, Florida.
Oh!
Yes, it is. Can you hear me?
Yes!
What's up, girl?
Hi, happy birthday!
Oh, thank you.
That is awesome.
I'm now in Orlando. I did 2 home visits last week. I actually did virtual visits with both of them prior to doing a home visit. I have committed to only doing in-home visits right now for families that absolutely need it. And these 2 families absolutely needed it. So I was glad I did it. I made sure that I only was doing 1 visit per day, so I'm not taking anything from anywhere. I also did make sure that the family themselves were practicing social distancing. So, one of them was a 6-week-old and the other one was a 4-month-old who I had seen prior to. COVID happening. So I just wanted to make sure that they were themselves practicing social distancing and that they hadn't been in contact, as well as them not showing any symptoms, although we know that people can be asymptomatic and still have it. I felt weird in the sense of wearing a mask just because
Mhm.
it's not what I'm used to doing.
Yeah.
However, I did keep it on the entire time, as well as gloves and changing gloves repeatedly through the visit. I also kept my own little Ziploc bag. So as I changed my gloves, I put them directly into the Ziploc bag and sealed it. So I wasn't putting the gloves that I was using anywhere, just to make sure. But both families felt really grateful that they could see someone. So here in Orlando, families haven't been seeing anyone. One of the clients was 6 weeks postpartum, and I was the first person to see her and touch her since she was released
Oh
from
wow.
the hospital with a C-section. So that was an entirely different thing, and I was just like, the good news is she had a 2-week virtual visit, but I'm like, you haven't seen anyone? And she's like, no. I said, no one's taking your blood pressure. Like, are you still bleeding? Like, what is going on? And so that was a bit much. But she was doing well, thankfully. But I was like, okay, if you're having a headache, are you having any of these symptoms? Like, this is what you need to do. So we went through that. So it's like, I don't have any, I'm doing everything I can to stay within scope, but I also want to make sure that these patients aren't dropping dead in their homes because no one is physically laying hands on them. So I just wanted to review with them the signs of postpartum hypertension so they know what to do if anything happens, like what they should do, and making sure they knew where the nearest emergency room was. So but both families are doing well. I've been following up with them. I've actually been doing free lactation visits or virtual visits because families aren't getting the support that they need, as well as WIC isn't seeing anyone. So, and Orange County was already very limited in terms of the services that they were offering as well. So, I've been busy, but with virtual visits, but I'm limiting home visits to exactly like the people who really need it. So,
Wow. So I have a comment and a question.
okay.
First, my comment is, I'm so thankful that you were trained under someone like Nikki to help you and equip you to be able to be competent in supporting families in this way. Fantastic. I'm really, really excited about little Nikki's running around and helping families in different parts of the country. My question is, what for you made it imperative that you see the families in person? What was it that you said, you know what, I saw you virtually. I really need to get eyeballs on you in person to see if you're
So
okay.
for the 6 week old, the baby had just had their second visit with the pediatrician, and the mom thought that feeding was going well, except for some latching issues. But then they did a weight, and he was on the 4% of the growth chart. And then she's like, the pediatrician said he's not worried about it. What do you mean he's not worried? He wasn't worried about it, but then said, give him rice formula, rice formula. Make him a bottle with some rice cereal and formula. And
Mm.
she's like, I'm not okay with that. I'm like, well, I'm glad you're not okay with it because I'm not okay with it either. Um, let's schedule a time if you feel comfortable where I can come. We can do a weighted visit, and we can see how much he's transferring. It won't be a complete snapshot, but we can get an idea and come up with a plan for this baby. And so I that was one visit. And then my other mom, she had a nipple bleb.
Mm.
Um, and she had consulted Google and some family members who weren't breastfeeding, had never breastfed, and they were like, she's like, I think something is wrong. And they're like, oh no, it's not mastitis if you don't have a fever. It's not a clogged duct or anything. So she waited about 2 weeks before reaching out to me. And we went through, I did triage over the phone and with a virtual visit with her. And I was like, okay, again, she hasn't seen anybody since she gave birth in February. So and she also had a C-section. Yes, she had not seen anyone because her 6-week and 8-week follow-up happened during COVID. So she hadn't seen anyone. So it was like, okay, well, I will schedule a visit with you. So I went over, I triaged her for her nipple bleb, and I was, of course, Nurse Nikki, I had her do apno. I had her do apno for her nipples. And then, so she actually followed up, and I was like, you're going to do this. I saw her when? Thursday, and I gave her till Monday. I said, if you're not feeling better by Monday, I want you to call your OB and make an appointment. And she actually went in and she had her appointment yesterday, and her OB said, you know, you've done everything right. Your lactation person told you keep using the apno, you're good, and she was fine. So I was glad that she got the help, and her nipples are fine. But I'm just like, I cannot believe that these women are not getting help. I know we want to protect them and keep them and their newborn safe, but this just doesn't seem the best thing to do 100%.
Thank you.
No problem.
Thank you. Wow. I think it you shed some light on something that's really interesting, in that, as we know, folks aren't getting the care that they need. Postpartum care is virtual now. It is not at all. There's no guidelines. We just had a call with A1 Louisiana edition this week, and they were saying that, while there are some prenatal visits that they go in for, postpartum, none of which have been indicated where you go in for. So even after a C-section. So with that being said, I want to know, how comfortable do people feel going to the A1 website and just handing out the postpartum warning signs as a part of your visit? Or if you've been contacting this person, telehealth, like, no one has talked to you about this, just double checking. Because one thing in my clinic, and Tamika would touch on this, is that at our breastfeeding clinic, we take blood pressures at our clinic, because I'm not doing this patient any service if I'm checking on her breast and then she drops dead because of postpartum hypertension. So I want to get a blood pressure. And with that, yes, I know that is not everyone's scope, and that's what the guidelines have pointed to, is that we have to stay within our scope. That's the first thing that IBCLC said with the guidelines, is please stay within your scope. Even through these virtual visits, we have a tendency to go above and beyond, because that we're the only people that they're making contact with. But please stay within your scope, because we don't want that to come back and scar you, and definitely do anything to the profession as a whole, and saying, oh, well, they're doing all these other things. So always, when in doubt, refer out. But also, if you don't have any refer, then refer them back to their OB, and then ask them if you can have a conversation with their OB and say, hey, this is what we've been talking about. This is my recommendation. Can you, co-sign on that situation? But the A1 website, for those of you, it's I don't know what A1, I can't even remember all the things, but A1 is about neonatal nursing, women's health, and neonatal nursing. And they have a beautiful sheet. It is a PDF. It's a one-pager. It's called Postpartum Warning Signs. And it just gives them a glimpse of when to call 911 and when to call your doctor with these things. And the family can look at it. The person can look at it, just so we know if something else is going on. Because with breastfeeding, all these other things can be happening. So she brought up a good point of, yes, we stay within our scope, but do you have access to additional resources that you can show them? Because Google is massive, right? And we have people on Google all the time looking up stuff, and they'll tell us, oh, I think this is this. And I'm like, it's not. That's a mole. So, we have to help them decipher these things, and they may not ever come up on A1. Why would they ever come up on A1, a website? So just have some resources that you can provide, knowing that they're not going to get any of it.
That's a great tool. Thank you. I didn't know about that sheet, and I will be downloading it now for my parents. So thank you, Nikki, for that. Thank you so much to, is it Tamiqua?
Yes, it is.
Thank you so much, Tamiqua, for your fantastic sharing. We'd love to hear from how our peers are out there supporting families to, share other experiences outside of Nikki and I. So thank you so much for that. Fantastic. Keep fighting the good fight out there. All right. Back to our topic. Nikki, what else? What else do we know? What is IBCLC saying? Break it down.
IBCLC said, so the definition, thanks, Nikisha. IBCLC says pathway 2, okay? Let's talk about our pathway 2 people. So
who is
first of all,
pathway 2?
I need people, let's start from the beginning. Pathway 1. That's me and my people, okay? It's my people and your people. We're pathway 1 people, all right? And you may think, well, how are both of y'all pathway 1 and one's a healthcare provider? Let me tell you. I'm pathway 1 because pathway 1 includes healthcare providers and people in the medical profession. So there's a whole list that you can go to their website and click on the numerous amount of blue links that they have on their website. And that was the one that gives you a whole list. Nikisha is a pathway 1 is because she's a part of one of the counseling organizations that recognize breastfeeding support counselor organizations. And you click on that link and it'll tell you who they are. And let you leave. So that being said, we are both pathway 1 people. Now, pathway 1, 2, and 3, you all have to have those 14 classes that you need, those courses. Everyone needs the courses. We have the courses also. I have them as a part of my degree. Nikisha has them. We all have to have these courses, okay? So the pathway 1 people, you can do your stuff virtually, all right? So you need 1,000 hours, all right? And you can do your stuff virtually. Now, the thing with the recognized breastfeeding support group, it says 500 hours per 12 months in person, and then 250 hours per 12 months telephone or online. So that recommendation actually just is a more recent recommendation.
Yeah,
and know this, they have not, and we were talking about this before the call, they have not reprinted the entire thing of all the recommendations. As you know, they just made some big changes in the past, like 3, 4, 5 months. All right. Those changes have to be translated into 16 languages. They were in the midst of translating into 16 languages when Rona came. Okay. So you're not going to get that whole big bundle. Don't print out that whole big bundle of all the pathways and all the recommendations. The new stuff is not going to be in there, okay? Because it hasn't been updated. They said the release for that will be November 2020. You heard? So stick with the guidelines on their front page of the IBCLC website. Click the most recent link, and it will take you to the most recent recommendations that they have made. Okay.
That's great news. So in other words, if you're a volunteer, at least, you used to be able to say you accumulated the 1,000 hours with 2 years of service to families in person. Now it'll take at least 4 years supporting families virtually if you want to do it virtually, or some mix thereof, I imagine.
Right.
There we go.
Right.
That's
exactly.
pathway 1.
And pathway 1, but we also want to say, and I'll talk about that in a second. Pathway 2 folks, all right? Pathway 2 folks, I have another sheet for that. Pathway 2 candidates now earn 100% of the minimum 300 hours of their directly supervised lactation specific clinical practice through secure technology platforms. Okay, so remember, our Pathway 2 folks are at the university programs and those organized fancy schmancy programs like that.
Like some of them give degrees,
you can do those,
some of them get certificates, but it's full-time at the university. Yeah.
It's a full-time at the university. And I'm sure your university has already talked to you about how to do your classwork and stuff online. The clinical part, 100% can be done through technology platforms. Now, with that, please remember that with that, you have to work within your scope. We have it. It is a tendency when you're on these, you just face that, you know. So you have to stay within your scope, and you have to meet. Still have to meet the things on your competencies. Okay. And then pathway 3 candidates now can earn 100% of their 500 hours through directly supervised lactation specific practice through secure technology. That means that your supervisor has to be on there with you. Okay. Otherwise it's just you out here living, you know, giving advice. And so that's the only way that we can know that you have met the competencies. Remember, you still have to have those core competencies. Make sure you print that out. And kind of, you can go through the core competencies and say, how can this be tweaked for virtual? Like, what does this look like virtually? Because some of them are a little, you know, a little in-person heavy. So go through them and with your supervisor and say, how can you go through those things? Now, one thing that I'm confused on, and maybe Angela or Nikisha can help me with this, is does the person, now that we're virtual, does the person have to be in the same state as their supervisor?
No. Quick answer is no.
So.
They don't even have to be in the same country. They don't have to be in the same country.
Oh.
Right. So, I mean, there is no requirement that the supervisor be, you know, I think it's important, though, for the supervisor to be aware of the geopolitical and the privacy rules in the other person's area, locality, because privacy is different in different parts of the world. And for example, a really good example is whether or not you can contact a pediatric provider or an obstetric provider. I know that there is a country where if you are concerned about a newborn or if you're concerned about someone, it is not okay for you to contact the pediatric provider. So that report that usually happens, that sort of, you know, warm handoff that happens, is not allowed in this country because of their privacy laws. So, but essentially a supervisor can be anywhere. I think it's also an important note that IBCLC has not necessarily given strict requirements for what supervision means.
Okay. That makes sense. That was a hole for me that I just could not wrap my head around. And also for the supervisor, like how many folks can be up on there? And that was something that came up with our clinic, is that how many people can actually be on this call? You know, we don't want to make this uncomfortable where, you know, we have on the patient and there's like 4 people and you're like, hello. And it looks more like an intervention than a virtual visit. Okay. So we have to make sure it looks comforting regardless of the fact that we're using a computer. Okay.
That's a great point. Excellent point. I'll real quickly, I'll refresh for those who are again new and trying to figure out how to enter the field. The requirements are those the clinical hours that Nikki's talking about right now, the 14 classes that she talked about, and also lactation education. Don't miss that part.
Oh, yeah.
Everyone needs 90 hours of lactation education, and we happen to know a fantastic place to get it.
What?
Shout out to
Take it away, Angela.
Shout out to Lactation Education Resources for making this call and all the previous 7 possible. We thank them so much and can't recommend them enough for a place to get your lactation training and education for prepping for the exam or prepping to retake it or just staying fresh on your information. Sorry, I had to put that plug in there.
Y'all plugging everybody. Okay. All right. So do we have any questions?
Oh.
Sorry, Angela.
No, that's fine. So go ahead and go ahead and type in your questions into the question box, or if you just have any comments. So we do have a comment here from someone who is in Central Massachusetts, and their WIC office is closed. And so their breastfeeding peer counselors are working from home. So I think it's important to note that the location is closed and yet parents are still receiving services that person is more than welcome to continue to type into the chat. If you're okay with me saying your name, please do mention that as well. There is someone who's listening here. I don't know if she's listening at this moment, but she said she's going to hop back on. She's on the Navajo reservation, and they are a baby-friendly facility. And so babies being born, and they're juggling the COVID-19 in the mix. And this person also states, thanks goodness for President Nez, who is the Navajo president, and Governor Luan Grisham from New Mexico. They're really doing a lot with PSA and transparency for the community and for the state. And so this person, hold on just a second, there is a comment here from, here we go, from Martin, who says that she's a CLC. Is this a time that you would encourage someone to continue and become an IBCLC?
Absolutely.
Oh yeah, don't stop. Get it. Don't
Without
stop.
reservation. I have a perspective about anyone who's pursuing the credential or trying to work in this field, and I really feel like there are families out there waiting for you. You alone, you and your unique voice and lens and way of support. There's someone out there waiting for you. You got to keep going because they need your help.
Mm-hmm.
So don't let this stop.
Yeah, and don't get bogged down by the circumstances, right? Like, yeah, it doesn't, but know that the help is still needed. Every level of help is still needed. And so while it may take a little bit longer in order for you to take that test, know that you're still able to help people until that logistics, right? Those are just logistics. The support, however, is what's really important right now. The logistics will still figure it out.
Yeah.
In due time, and then they'll let us know in the evening.
Nikki, were you able to find anything for folks who are recertifying? What do they need to know?
They said continue as normal. This should not affect you at all. Because luckily for them, they just put in that situation where you don't have to retake that test. So, but they said all the stuff that they were supposed to be doing, that's actually already been taken care of. But who's to say that won't change for the next group of folks? But know that they said there are no further recommendations for them at this time.
So yeah, so I'm recertifying this fall, but I was going to do so by CERPs anyway. So this doesn't change that.
Mm-hmm.
I still do in the fall. I still need to apply by September, and in the case of auditing, have my CERPs ready for me.
Yeah.
Those who are going to retest in the fall.
Sorry, I can't get you out of this at all.
If you were going to test to recertify in the fall, are you saying that they don't have to test, that they can recertify by CERPs, or wait?
I'm saying that there is no. They said wait for more information as far as the test is. Stay tuned. Check that email. I did want to touch on baby friendly for a second. Someone brought it up. We had a talk here about baby friendly and how it is nearly impossible to separate the baby from the parent, the COVID positive parent, when you're a baby friendly facility, because that goes against baby friendly. And also, they don't have a nursery.
Right.
So they don't actually have the room for it. And it has to, and if they do have a nursery, it's for babies that are needed, like they're COVID negative babies, and we don't know about this baby over here. So they said, I don't actually have anywhere to put them. So they're putting them back in the room with the parent, with a barrier, so the curtain or whatever. But there is also a waiver that families can sign. And it's like, you know what, just give them a baby, and where they can be close to their baby. So know that waiver, it's on the, there's one that's been created by evidence-based birth, and you can go, and it's a sample form. I've given it to several hospitals, and they've adopted it, where the family can just, the legal department has looked at it, family looks at it, signs it, and the physician signs it. So I know that some people had questions about that, like, we're a baby-friendly facility, and we're not supposed to separate the baby, but this situation is happening. Know that, everyone has been dealing with that, and they've come up with pretty creative ways to combat that.
Yeah. All right. Okay. Sounds like we have more questions and comments.
Yes, so just want to give a shout out to the person who's on the Navajo reservation is Nicola Pierce. She said it was cool for me to use her name, so thank you, Nicola.
Hey, Nicola.
She's in Shiprock, New Mexico, and they have nurses who are also CLCs and a couple coming up through the ranks. They have an LDRP unit, which is a labor, delivery, recovery, and postpartum unit, which is a conversion of an old L&D and postpartum. They do couplet care in place, and their CLC is a big part of their care in the OBGYN and baby friendly, which is great. And then so that is Nicola. Then I have a
the standard there.
yes, I have a very funny comment here. Okay, so we have Rashina Moss,
Okay.
who is a certified breastfeeding specialist in New York. She is thanking you once again for discussing an amazing topic. With the changes in internship requirements, is LER updating their list of mentors and supervisors?
Ooh.
She's on pathway 3. She said she was securing an internship right before COVID shut the hospitals down. And she also wants to know if she can ask the two of you if you were willing to be her mentor.
Rashina,
Aww.
I am in like a tent city right now, honey. You don't want my help in this moment. I'm in the middle of a cross country move and I'm just holed up in a corner. But once things settle down a bit, holler at me. Let's talk. Let's do it.
Yeah, I actually am not accepting any more students right now. I'm not doing any lactation visits at this time. I'm only doing prenatal and postpartum care because we're so backlogged with that with our homeless population. So once that is all done, but we have other folks at the clinic that are handling that. So, and then we already have like 3 students. So I don't want to, while I think it's great that a lot of people are like, oh, these students need it, make sure as if you're the mentor that you limit yourself and know what your capacity is to give that time, because it does take time. So yeah, but holler at me at the end of the summer. May have my life together.
Yeah, I hope and expect that with this shifting of the guidelines, more mentors will become available. Like, oh, I couldn't physically um, um, mentor or support someone, but virtually I can show up on the calls. This is my thought, at least, that more folks will be able to
Right.
support virtually that could before. And so hopefully the doors will open for more and more of these mentor-mentee relationships to flourish.
Right. Angela, does everyone know about the mentor list that y'all have?
So we don't have a mentor list per se, but we do
Okay.
have, we can usually help to place people who are looking for a pathway 3 internship. And many of our spots, as Rashina mentioned, many of our spots are in hospitals. And so I do believe that we've got some people who are interested in being mentors, but they don't know how to do it. And I think they're trying to master the technology first. I think that this is an amazing opportunity for people to get that sort of support. I think once IBCLCs figure out the technology, then I think they may be more open. And yes, I agree with you, Nikki. You don't want to have 4 people there, just sort of staring.
Yeah.
That's just not a comfortable space to be. And I would assume that these mentors would be able to find that space. And if they would like more information, please do reach out to us, because we have an internship coordinator and she is looking for mentors left and right and everywhere. So please do. So we have
Great
another
idea.
question. Someone's a pathway 1, almost finished with the 90 hours through
Congratulations.
LER.
Nice.
And she is in a required clinical hours, almost done with being a postpartum nurse and some credits from her BSN. So she's planning to apply to take the September exam in the next few days. Is the exam still expected to be given this September, and is the date for applying still May 29th?
You think it's an info session?
Is that an answer to the
No,
question?
we
That's what I was
actually
just
we
saying.
don't know.
We can only give
we
you what we
actually
have, honey. We can only give you what we have. We know that some
what
things we
what
haven't disclosed yet. Yeah.
what it is, unfortunately. Uh, so and I print out their most stuff, and they actually have that in about test September 20 test the date. So you have to go along with that and make yourself just in like, oh, we- so do it just in case. Don't wait for the fact that they may delay, which it could very well be one, but go ahead and get your stuff in now, in the event that they do still stick to that hard guideline. And we don't know, like you apply for the 2020 in September 2020, and then in July they're like, actually we can't do it. At least you've already applied, your stuff is already in there, and you're on their list to place you in a different exam space.
Yeah.
And
Yes,
I would agree
same.
with
I
that.
recommend moving forward. Yeah. And good luck. Sounds like you have got a lot going on.
Yeah. Mhm.
You got this though.
No kidding. So, and also for those IBCLCs who are scheduled to recertify by exam this year, at this moment, that has not been waived. People who are recertifying after 2022 will not have to recertify by exam. So we'll not have to recertify by exam. So just FYI, that guideline is still live for 2020 and 2021. So do apply at the appropriate times. And IBCLC, as you said, the IBCLC will let you know if things change. Okay, so a question here from a public health nurse in Canada, Winnipeg. I'm just
Hi.
completing the online 90-hour course. As the date for April has been delayed, might it be possible to do the test earlier than waiting until September of 2020?
So I'm not a representative for IBCLC, but I can just think about it from a business perspective. It's going to, they have to make sure all the other countries are in alignment because everybody takes the test at the same window, right? So I don't actually know if they're going to move it up, but I'm saying it's going to take a lot of resources to make sure every single location has the same level playing field, I should say, that it's everyone. They have the standards are there for them to take the test. There are no barriers there that have presented themselves since the pandemic coming. All of those have to be removed first in order for the test to be administered. And I probably think that it's going to take them some time, while the rest of the world and even Canada is on a different path in the United States. I see here there are tons of barriers in place at this time for if this test were to proceed. Just looking at California's a still stay-at-home order, like that. All the here ours hasn't been lifted. We're probably gonna have another one in the summer. The way people are wilding here. So and then New York, same. So we have to there's still so many barriers in place. I don't foresee that it's being lifted unless they give the United States a different test date, which I don't know about that either. So I'm sorry that we don't have more definitive stuff about the test. That's one thing that they didn't really expand upon in the updated interim guidelines.
So Angela here, and I can say that no. I can say relatively definitively,
Yeah.
that was a lovely politically correct answer you gave, Nikki, and I can say no, it will not be given any sooner. And it does have to do with all the translations that you were talking about before, and it has to do with the security of the exam. So it is twice a year. It used to only be once a year. It was only in July. So, we've moved this far, and unfortunately they cannot, change that. So just sort of as an FYI, just to let people know. Okay, another question here. And again, Tamiqua is finding that, finding a mentor is more challenging. And she's having a hard time obtaining those clinical hours. Is there anything that you can say, considering the latest guidelines here, as far as if you think that this is going to be these new requirements, do you think this is an additional barrier, or do you find this is something which could help people move along? What's your opinion of this?
I actually see this as an opportunity, just like with and my mentor kind of gave it to me with this perspective of you can now let's think about when we telehealth or teleconsult with how we broaden ourselves. I can now reach Central Louisiana, right? Central Louisiana has nobody there. There's no birthing hospital, nothing. They either have to go to Northern Louisiana or Southeast Louisiana. So now I have that opportunity. The same can be true before finding a mentor, you may not have had a pool of mentors in your space. But now, with their, being very open interpretation of these guidelines as far as where your mentor can be, you can actually pursue other spaces. And, maybe she's like, well, I've never even had mentees. Now she has the opportunity to have them because the doors have been open. But it does have that change of this is telehealth, and you won't have that gold standard of lactation support of that what you would get in a one-on-one person, but you can have some form of it.
Yeah, I see it, very similarly. I think it's the adjustments have been made so that folks can continue to move along the path toward the exam, even in this world where we find ourselves not being able to connect directly. And so there are new opportunities, additional opportunities for you all to get the clinical hours in than you had before this began. And it's different, and the landscape is shifted, and boy, those folks who were mentors before may not be comfortable mentoring in this new space, but there's a lot of people who are really tech savvy, and this is within their comfort zone. For me, this feels more comfortable because the work I do is private practice and all over the city, and having someone come with me or accompanying someone on those visits was a little bit more difficult for me to arrange than for me to visit and accompany you now on a virtual visit, or for you to accompany me on a virtual visit. Any of that is an easier thing to accomplish for me in the way my life is set up. So there are going to be different mentors available, but I certainly hope more of them. And I think it would behoove a number of organizations to start to help to match those folks up, match up mentees and mentors who are both comfortable in a virtual setting, supporting families. And I think you should be on the lookout for that. More and more of that is going to present itself as time goes on. I don't think we're going back to the space where all the work we ever do is in person. I think we're beyond that now. And so a good deal of all of our work will be virtual, I think, moving forward. And so the way that we get the credential, the way we travel on the journey toward the credential is going to look a lot different as well. And so we're going to see a lot more virtual touch points, period. Across the board. So look at this as an opening, as an extension, as an expansion of possibilities instead of the opposite.
A limitation. Yeah.
Yeah. Thank you.
Okay, so this is a bit of a long question. There's someone here who is sounds like North Carolina, and they are a registered nurse looking to receive lactation consultant licensure. If I'm not already in the maternal child nursing field now, is it going to be harder to find a supervisor for breastfeeding counseling hours at this time? What resource do you recommend for technology-supported breastfeeding counseling?
I think I understand your question. You're currently not in the field of maternal child health, so you want to know, is that going to be a barrier for you to find someone? I would say that while your job is not in maternal child health, your community, there are tons of resources in your space, and I would say seek those resources out and find out, the contact people, get into the circles, and become as immersed in that community as you can. Because while you may practice, in hospital lactation, that may be your goal, you can start to get your feet wet in community lactation, which is still a great space and it's much needed actually. So especially during this time when folks are being released so early. So it doesn't. I mean, I know a lactation person that's a zoologist. That was her former life. Like, you don't have to have that background. So keep that in mind, that's not a barrier per se. It is now you coming in with a whole fresh set of eyes. The expertise that you have from whatever space you came from can still glean in this area.
Yeah, that's kind of this area is my sweet spot to talk about. Yeah, so my background, I'm a marketer and a ghostwriter, and I didn't have any of those science classes necessary before I started to pursue the degree, the credential, because it just wasn't in my background. So certainly anyone who's interested and dedicated and devoted enough can pursue this credential with or without any type of medical or healthcare background. I cannot stress that enough. And yeah, so I think that I think the world is your oyster. You have the opportunity to pursue this in any number of ways, and to be creative and resourceful and look around in places that aren't, I think, the obvious. Look for mentors in spaces and places that aren't where you may traditionally find them. So outside of a hospital setting, look in your community, look in spaces where families are being served non-traditionally, and I think that you'll find some really cool opportunities there to support people in your community, or in the hospital if you want to stay in that setting. There's that as well. I hope that was helpful.
Thank
Yeah,
you.
your hospital lactation department will probably have a list of your community organizations that they may refer to. So you want to maybe go ask the hospital lactation folks.
Yeah, this is, I think, a good point to mention. So some of the work that Nikki does is with homeless families. Some of us do work with families that are impacted by sex trafficking. There's all sorts of, if you think of, where you are passionate, there's ways to marry up this work and fill a niche that I'm certain is open. There's holes, gaping holes in all sorts of communities that are not being served right now. So think about what you're passionate about doing, and the path will kind of lay itself. That's to everyone listening, everyone.
Wonderful. Thank you so much, she says. And so last question is, I completed my 90 hours with LER and I'm almost done with my interning hours, so I don't know when I can apply to take the next exam. Do you think I will be able to take it in September? And then the next person says, is there another exam after September of 2020?
In theory,
Go ahead.
yeah. So in theory, there's an exam every fall and every spring, right? So then you get you get on
Right.
the spring if you miss the fall. I think it's
Mm-hmm.
wise to finish all of your prerequisites before applying for the exam, because every certain number of people is audited, and you're asked to provide proof that you've met all the requirements for the exam if you get audited. And so you don't want to go into it not quite finished with anything. So yeah, complete all of the prerequisites, and if you map it out now, then you'll be able to see, I don't know if I can finish that by fall. Let me go ahead and plan for spring 2021, knowing that because everything is in upheaval right now, lots of folks are going to be waiting after this missed test period, this most previous or recent one, that the seats may shift, and you may be pushed out to the next testing window.
Mm-hmm.
So be open, be flexible, be ready for that type of feedback, but also continue to prepare to get ready for the test. What do you think, Nikki?
Yeah, absolutely. Go ahead and get all your stuff in and do, just stick to the dates as if nothing has happened. Go ahead and get your stuff in, do the things that you're supposed to do within those dates, have your stuff ready in the event of an audit, like act like nothing has happened, and then they will dictate when shift the as needed. But know that your stuff has already been done, and they already have you in the system. So you don't have to say that they get my application, all those type of things. You don't want to move, you don't want to go with the shift. You want to have it already in.
True. That's it.
Excellent. Thank you both
Hey
so
guys.
much.
You're welcome.
So I do appreciate y'all taking your time today, especially Nikki on her birthday. Yes, I'm going
Yes.
to say it again.
I feel
For the
like we
people
should
who
sing.
didn't hear, oh,
You don't want that. You don't want that, trust me. Yeah.
her children singing will be enough for her, I'm
Yeah.
sure.
Yes.
Yes.
So thank you both so much for providing this space, for answering these questions, for providing so much good, counsel and reassurance. I've had many people tell me that this is like the best part of their week, the highlight of their week, to
Oh,
watch the two of you, to hear the two of you present. This has just been so delightful. So lots of love coming in through the chat right now. So thank you both so much.
thank you. Thank you. On that note, we will
Thank
share that
you.
we're going to take a break now. I think we have 7 or 8. You please enjoy the recordings of
Mm-hmm.
all the previous several Wednesdays that we've come to you with our weekly COVID Q&As. We're going to take a break for the rest of May, and then we'll be back in June. Not quite sure how frequently we'll do those starting in June, but you can be a deciding factor in that. So if you have things you want to hear about from us as this dynamic environment continues to change, please reach out, let us know, email, hit up any of LER's social media or Nikki and Nikki's social media. Let us know what questions you have, how we can answer, and what you'd like to hear from us. And we will be back in June with a bang.
Yes, 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 yes.
Excellent.
Thank you, everyone, for all of your support and always tuning in and bringing it with questions and tagging us and, sharing it. We really, really appreciate all of the support.
For real, for real. Be safe, be well, take care of yourselves, and we will see you real soon.
Bye, everyone.
Take care.